I'm Dr. Laura Shaheen at Pacific Northwest Fertility, and I want to talk about an integrative approach to fertility care, which means combining Eastern medicine techniques with Western medicine techniques to find the best care for the patient. Western and Eastern approaches to fertility care are totally different. They're different approaches to medicine in general. Western medicine is very much catastrophic medicine. If something's broken, like your arm, you're going to go to an orthopedic surgeon and have it fixed. Where Eastern medicine is not going to necessarily fix a broken arm, but it is the ultimate preventative medicine. It's trying to maintain balance through nutrition, healthy sleep habits, exercise, supplements, overall well-being, diet, in order to keep you in balance and keep you in your maximum health. If anything gets broken, Western medicine is a great fix, and Eastern medicine is about maintaining health. My interest in an Eastern and Western approach to care really came from a collaboration with an acupuncturist. This acupuncturist was writing a book on Eastern approaches to care and wanted my input as a Western medicine provider, a little information about what intrauterine inseminations are like and IVF, and we came together with this project. Through that project, I learned so much about the thought process was behind acupuncture, herbs, supplements, and it really opened my eyes to the potential benefits for patients. In fertility, traditionally, Western medicine providers have been very focused on Western techniques like IVF and intrauterine inseminations, and really, kind of ignored acupuncture or herbal medications, and Eastern medicine providers have really been sort of anti-Western techniques like IVF and intrauterine inseminations, and the patients have kind of gotten stuck in the middle and sometimes even feel uncomfortable sharing with their Western medicine providers that they're doing acupuncture, or sharing with their acupuncturist that they're actually getting ready for their IVF cycle. And I think that coming together can really benefit the patient. Common questions that patients ask me are, should I do acupuncture? What supplements should I be taking? And I really try to review everything with each patient because every patient is different. If you hate needles and are terrified of even considering going to an acupuncturist, maybe that's not the right thing for you. But if you find that it's relaxing or you find benefits or you're open to it, maybe it's something to consider. It's not automatic. It's not like every single person needs to do acupuncture, just like not every single person needs to do IVF. But let's talk about it, and let's find what's right for you. We really want to be providers here at Pacific Northwest Fertility that allow an open conversation. Some patients are scared to tell their doctor that they're doing acupuncture or taking supplements because they're afraid that they're going to be made fun of or that their provider isn't going to be open to it. And I want to encourage an open conversation so that we can kind of come to what's right for that patient. Everybody's looking for that miracle supplement, the youth serum that's going to make their IVF cycle a success or make their eggs or sperm better. And there are fads, there's things that kind of come and go. And as a fertility provider, I want to find that too, but I'm watching the literature, I'm learning, I'm gathering information, and we just have an open conversation about it. One thing I really try to emphasize with patients is if they are taking supplements is to be very careful about the sources of their supplements and be cautious about how much they're taking. More is not necessarily better. There's no oversight of herbs and supplements and things that you can buy without a prescription. And really, sometimes what is on the label is not what is in the bottle. So you really have to do your research and be very careful about what you're taking. And, a little bit of some vitamins can be very beneficial, but probably you're going to get most of your vitamins, if you can get it from a nutritional source, is better. And mega dosing on vitamins more is not necessarily better. So we really need to have an open conversation about supplements. I think the future of fertility care is somewhere in between, and finding benefits from both aspects of medicine to help the patient.